Last night, Tua Tagovailoa took another concussion, and I believe one of his previous ones was also against the Buffalo Bills. Now, there's a lot of questions from, wow, what happens in the brain with a concussion, to should Tua even still be playing football? Like, is it time that he needs to throw in the towel and, he just really shouldn't be playing? Now, make sure to, if you've got questions, let me know. But what we are going to review in this is we're going to review 4 things that you should know about concussions. We're going to review things from symptoms to imaging. Is it beneficial or not? When should an athlete actually return to play? We're going to look at the NFL's return to play policy and whether or not it truly is sufficient. And then lastly, what are treatments that someone could consider for a concussion? So now, if you saw the hit that he had, right, it was from the side and his neck gets really crunched. So he's probably going to have cervical issues, so his neck, on top of his concussion issues. Now, what are the symptoms that someone could have with a concussion? Brain fog, fatigue, headaches, blurry vision, mood changes, sleep issues, poor concentration, poor word finding. So those are all the different symptoms someone could have following a concussion. Now, super important to know that you do not need all of those symptoms to have had a concussion. According to the latest criteria, you only need 2 symptoms that are either new or worsened since you suffered a concussion. So maybe you had pre-existing ADHD and now your attention's a lot worse. Maybe you also had pre-existing sleep issues, and that's a lot worse, or depression. Well, that would meet criteria for a concussion. So that is something to know. So what are those symptoms? Now, next is a lot of people get confused because they'll go to the emergency room and they'll get imaging for a concussion, and they are very frustrated. Well, I did a CT scan, I did an MRI, and I was told it was normal. Well, guess what? CT scans and routine MRIs are going to be normal every single time with a concussion. This type of imaging is not actually meant to pick up a concussion. It's meant to pick up bleeds, meant to pick up fractures. Now, there are other types of advanced imaging that are being researched that can help pick up concussions. So you need to know about that. Do I specialize in sports injuries? I do a ton of concussions. I don't, right? I'm not your ACL guy. I'm not your MCL. I'm not your rotator cuff. I fix brains. That's what I do. So imaging, once again, is not going to pick up concussion. So let's get that out of the way. We've already reviewed the symptoms, right? Headaches, fatigue, brain fog, word finding, mood changes, sleep issues. Next, when should an athlete return to play? Should Tua return to play, or should he throw in the towel and retire? First article I saw this morning was fans clamoring for Tua to retire. Well, when we look at the NFL's return to play policy, now I think it is lackluster. And I'm going to first review what it is, and then I'm going to tell you why it's lackluster. So the very first thing you do is, right, any potential concussion, you're getting yanked, you're getting 2 evaluations from a team doctor, but then also an independent medical provider, typically being a neurologist in the NFL. And if they decide you have a concussion, you're out. They then will slowly graduate you back into play. So a little bit of physical exertion. We're also saying, hey, we've got to have your symptoms down before we can do anything else. So once you are good without any symptoms, then we can let you move forward into higher and higher level. So eventually go into contact, and then we return you to play. So there's actually about 5 or 6 stages in the NFL's return to play. But for the NFL, I don't think this is actually acceptable. Why do I say that? Well, the NFL is a different beast. The NFL is not the general population. Each team is worth what? 2-3 billion at the least, and worth high-end 10-12 billion dollars. So this league is worth what? If they were to try to sell it, $500 million, maybe $1 trillion. There's no shortage of money in the NFL, which means they should be doing everything to the highest level possible. So for them to spend $20,000, $30,000 evaluating a concussion, making sure athletes are truly being returned to play safely, should be expected. It should be something they are doing. So what does that look like, right? So whenever I see someone with a concussion, we're doing a very in-depth physical examination. We're looking at eye movements, we're looking at balance, we're doing cognition screenings. And our goal is to get all those evaluations to as close back to normal as possible, as well as having no symptoms. Now, whenever I return someone to play, I say, hey, from everything that I can measure, you have recovered. But once again, the NFL, they have an unlimited budget, which means all the things that are being researched for concussions, there is blood work that can be done. Neurofilament light chain, GFAP, so glial fibrillary acidic protein, matrix metalloproteinase 9, MMP9. There's other markers like that, right? They should instantly be getting $1,500 worth of blood work looking at, wow, is there inflammation in the brain? Is the blood-brain barrier intact? And then one of the best images that I think's coming out, it's a PET scan. Now, it can look at inflammation in the brain. They should be doing that too. Now, understand that most of us, right, don't have $5,000 to $10,000 to just get imaging and then go and try to get treatment on the back end. But the NFL, they do. They do have this money to do a $10,000 workup to say, are you better? Because when we come to Tagovailoa, he had those 2 concussions within way too close of a time span because they botched. Let's face it, they botched the whole evaluation. And now he's got another one. Honestly, when you look at what happens in the brain with a concussion, he should be out at least a month, at least. Because one of the biggest myths out there is that an absence of symptoms means you have recovered. This is not true. An absence of symptoms does not mean you've recovered from your concussion. So the question is, should Tua Tagovailoa actually come back and play, or should he throw in the towel? Now, make sure to subscribe if you haven't. Give me a like, comment, and share this as well. And for me, if they are not willing to put Tua Tagovailoa through that aggressiveness of an evaluation, he should not return to play. He should retire. It doesn't matter that he just signed a massive contract, because guess what? Millions upon millions of dollars does nothing for you when you get dementia in your 40s and 50s. Okay. Yeah, maybe it pays for a nursing home. But guess what? Dementia tears apart families. I see it. I see it in my clinic as I treat people who have cognitive impairment and dementia. Especially the more the money's involved, the more the fighting is for who gets it. It's not worth playing. So if they're not willing to do it, no, he should not be playing. But if they are willing to bring him through the advanced imaging that is going to be available in those major cities, because they do have research hospitals where they can use the latest technology that's being researched for brain injuries, the latest lab work being researched for brain injuries. If they can do that and they can demonstrate, hey, Tua is symptom-free, he's functioning appropriately, so his balance, his eye movements, his cognition, everything looks good. But then we can demonstrate that the inflammation in his brain is completely resolved. There's no issue with the blood-brain barrier. So yes, you've got this blood-brain barrier that's meant to protect what comes in and out of your brain. With head injuries, with concussions, that blood-brain barrier gets breached and it lets things from the body, the immune cells and other things, come into the brain. And this creates an ongoing inflammatory response. And this is one of the reasons why we see those with multiple concussions, brain injuries, ultimately can end up with CTE, which the NFL has tons and tons of cases in CTE. When they look at people that used to play in the NFL that have committed suicide, what do they routinely say? CTE. And it's because this is the unresolved inflammation that keeps going and going and going in the brain. And once again, I don't expect the average person to have this level of evaluation. The average person may not have $10,000 to do testing once. And that's before you say, okay, that testing's abnormal. Now we've got to repeat it again in the future and do everything else, right? You can actually be looking at $30,000 to $50,000 treatment. But for the NFL, guys that are being paid millions a year, what is their excuse? What do you think? What is their excuse? Like, what is preventing the NFL from taking concussion seriously? What do you think? Is it because they don't want to admit what concussions are doing to the brain? Is it because they really don't care about the athletes? And at the end of the day, as long as they're making their billions a year, they're okay. And maybe they consider these guys replaceable. I don't know. That's normally what you do, is if you consider people highly replaceable, you usually don't do the testing. That's okay. Well, concussions ruin your life. Bye. And then we'll just get someone to replace you. So I'm going to quickly recap everything we talked about with this. So one, what are the symptoms of concussion? Brain fog, so word finding issues, focus and concentration, feeling confused, dazed, not thinking as fast as you should, fatigue, headaches, fuzzy, blurry vision, dizziness, coordination issues, mood changes, sleep issues. Now, once again, you don't need all those. You only need 2 different symptoms that are new or worsened since the injury occurred. Number 2, routine imaging does not pick up concussions. CT scans and MRIs are worthless for concussions. They are done when we are worried about something beyond. We're worried about bleeds. We're worried about fractures. Now, there is some advanced imaging in research being used for concussions. I think the one that has the highest potential is a PET scan, but functional MRIs are also being researched and they do show things. Now, it should be noted that any one of these does not pick it up. So you may have to do both a functional MRI and a PET scan to really get a full picture. 3, when should an athlete return to play? Ideally at the highest level, when their immune system has returned to normal, they have no symptoms, and their functionality is good. Until then, you know what? It really is questionable. I understand not all the imaging is available. So at the lowest standard, if your kid's playing sports, please, please, please do not put them in the game a week later because their symptoms are good. There's no research that supports this. 0. There is research, though, that says, hey, you are not yet better. There's worsening of changes in the brain at 1 to 2 weeks following a concussion, even though you're asymptomatic. To put someone back in sports 1 2 weeks from the injury is to ignore what we know about concussions. It is negligent. But, you know, the research isn't conclusive. Okay, it's not conclusive. But are you going to err on the side of your kid playing a sport, or are you going to err on the side of their future? You only got one brain. There's no replacing it. You can't replace it like you can a knee, a hip, a shoulder. It's the only one they've got. Your brain determines who you are, your ability to have relationships, your ability to make money, your ability to experience joy, your ability to create memories. We've got to stop sacrificing our brain for these temporary short-term wants. It's dangerous. We've got to stop doing that as a society. I get it. I played soccer growing up. People have a concussion, they'd be back playing, you know, either that same game or a couple of days later. And I knew nothing about concussions then. But the amount of research that's come out over the past 10 to 15 years tells us that really is unacceptable. And lastly, what treatments are there that could help with concussions? The days of sitting in a cold, dark room without any sensory input is gone. Those recommendations are in the garbage. It's shown that if you actually do that, you slow recovery, you prolong recovery. What is the best thing up front? Low grade physical exercise. Now, you don't want to be exercising into symptoms, but stationary bikes, little walks, driving blood flow and oxygen in the brain is super important for it. 2, make sure you're promoting sleep. Maybe it's melatonin, maybe it's CBD, maybe it's valerian root, right? I prefer using natural things for sleep that allow you to get into sleep and not going to mess with your rhythm. 3, because eye movements, balance, and cognition can be thrown off with a concussion, those should all be evaluated. And then there's treatment that can be done for eye movement dysfunction. This is not, you need a new prescription, but this is actually eye movement dysfunction, treating balance, treating hand-eye coordination. Those should be done. Now, those are all accepted. Now we're getting to the space of what's not fully accepted yet that I see good benefits with. Low-level laser therapy. Low-level laser therapy is known to help reduce inflammation in the brain, support how well it produces and uses energy. Next, hyperbaric oxygen therapy, preferably at a lower pressure, so 1.3 ATA up to like a 2, can also help people recover faster, is what I see clinically. Next, specific nutritional supplements such as fish oils, curcumin, glutathione, acetyl-carnitine, different things like that can help, once again, with inflammation and the ability to produce and utilize energy. When we stack all those things together, I routinely see people do really well with their concussion recovery. So if someone says, hey, you've got a concussion, go sit in a dark room, don't do anything. Honestly, they're so outdated on the research that there's no research to support it. And you should start doing stuff, but don't push through your symptoms. I'm actually not even a big fan of people loading up on ibuprofen, Tylenol, Excedrin, because it's okay if you do it for a headache, but just because your headache starts going down doesn't mean you need to keep doing stuff, right? It's like having a bad ankle injury. Well, I mean, I took enough painkillers that I can't feel the pain in my foot, so that means my foot has healed. Does that mean your foot's healed? No. Same thing is true with the brain, right? If you have the ability to get rid of your headache because you take a medication, that does not mean your brain's actually in a healed spot. So that's my take on Tua Tagovailoa. Should he retire? Honestly, depends if they're willing to do it right. But if they're not, he absolutely should retire. What questions do you have? I'm going to take a few minutes to answer those related to concussions as we've reviewed symptoms, testing, when they should return to play, and that side. And lastly, if you haven't, make sure to subscribe. Because if enough people do, enough people leave comments, hey, I'll do more of these lives in the future. Because at the end of the day, I'm sick and tired of having to treat people who come in 10 years after concussions because they never got the right treatment to begin with. You should be getting the right treatment within the first month, so that way it doesn't have to impact your life moving forward. And that requires us to take it seriously as individuals, as medical providers. So, hope you got something from this. Once again, make sure to subscribe. Until next time, this is Dr. Z. I'm known as the Brain Guy.